Good evening, everyone. I am presenting on advanced rotate and back it out, novel technique for barred fish hook removal from eye. No conflict of interest, no financial interest to disclose. Fishing is not only a pastime job, but a profession for many for their livelihood. Ocular injury due to fish hook is prevalent in many parts of the world, and a very few has been reported in literature. Fish hooks are of different types and varieties. Some are barred, some are barbless. Various technique has been reported in literature. Exact removal technique depends on the type of fish hook and part of eye involved. So we discuss a modified technique of fish hook removal from perforating corneal injury in an early teenage male. To our knowledge from literature, such technique has not been discussed earlier. So an early teenage male presented to our emergency after being injured in his right eye by a fish hook while playing, with presentation of diminution of vision with pain and watering from right eye. So this is the preoperative image and presentation. We can note fish hook from in the cornea. So we plan to manage the patient by fish hook removal under general anesthesia, and intraoperatively side put was made by extending the exit point where tip of the fish hook was visible. So fish hook was advanced to some extent and rotated to 90 degrees to free the barb from the corneal tissue, and retracted back and again rotated back to original position and then taken out by a back it out technique. So this is a pictorial representation of the steps. And corneal suturing was done, AC formed, intracameral antibiotic injected, eye patched, fish hook and AC tab was sent for culture and sensitivity. So this is the intraoperative images after suturing. This is the fish hook which we moved. Post-operatively, systemic and topical antibiotic and steroid were given. Topical cycloplegic was given. So the outcome and follow-up from day 1 to day 90. This is day 1, showing deep stromal infiltrate around the entry wound and intact overlying injury, corneal iron pigmentation, hazy edematous cornea, streak hypopyon with visual acuity of finger counting close to face. This is week 1, which shows endoexudate. So we started oral antifungal and topical antifungal, and visual acuity was 2/60. This is week 2 with loosening and infiltrate around the sutures. This is week 3 picture. This is week 6 showing almost resolved infiltrate and visual acuity of 6/12 with the pinhole. This is 3-month follow-up showing corneal scarring with reduced iron pigmentation and visual acuity of 6/12. So fishing involves a fish hook which is attached to a string and stick to catch fish by engaging fish hook in the mouth. If entangled in the human tissue, make it difficult to remove or retrieve. So knowledge about fish hook and their removal technique is necessary whenever encounter such patients. Various technique has been described in the literature which are retrograde, string yank method, needle cover method, advance and cut method, clamp and retract technique. So in retrograde method, downward pressure is applied to the shank of fish hook and it is backed out along the entry of point of entry, mainly used for skin injury and barbless fish hook. Ahmad et al., Naktusa et al., and Balvarov et al. Use this technique for ocular injury. Needle cover method is large needle bore is passed and guided over the barb. Fish hook is taken out by retrograde method, mainly used for the posterior segment injury. Grand et al. Use this technique for posterior segment injury. String yank method and advance and cut methods is mainly used for skin injuries, in which in advance and cut, the plier is used to cut the advancing edge and then the rest of the hook is taken out by back it out technique. Clamp and retract technique, Kelly's forceps is used to clamp and flatten the barb against the tip of the fish hook. Fish hook is retracted back through the entry wound, and Brown et al. Use this technique in an eyelid injury. This is a summary of various fish hook technique removal. Hit and trial of multiple techniques are generally applied before the fish hook is successfully removed. In our case, we avoided advance and cut technique to prevent iatrogenic trauma. Retrograde or backout technique is mainly used for the barbless fish hook, so we avoided this technique. Needle cover is mainly used for posterior segment. So to conclude, our technique can be used in barred fish hook if entangled in the anterior chamber. However, if resistance is felt during rotation, it should be avoided. Ophthalmologist needs to be aware of such cases and technique of the fish hook removal for better management of such cases. Thank you so much.